I am Dr. Kristen John, and I'm here collaborating with Ask the Doctor series, and I'm going to speak to you today on developmental disability. Now, when you hear the term developmental disability, I want you to understand that that could be a wide variety of disabilities that I'm speaking to. But today we're just going to focus on two: cerebral palsy and autism. So I am a registered physical therapist and a musculoskeletal specialist. I work with all ages, and I hope that my experience and my clinical expertise allow you, the parents, the ability to be able to better identify some of the common developmental disabilities that we observe in children and note how to cope with it, because there is help. You just have to know where to look for it. So what is developmental disability? And anytime you see in the presentation the term DD, that's what it represents. And it is a group of chronic conditions, meaning it lasts for a very long time, due to mental and physical impairments. Now, cerebral palsy and autism has actually been increasing in incidence, meaning the amount of persons who have it over the years. But this could also be as a result of just increased awareness. Regardless, we need to know what are some of the signs that we have to look out for. We're going to first start talking about autism, and this has been gaining some traction, especially through the movies and through social media, as we have a lot more persons being aware that we have wonderful children and adults in our society that may be affected by autism spectrum disorder. I want you to understand that just as the name says, it's a spectrum. Think of yourself having a ruler that goes from 0 to 12. The child or the adult may show some very mild signs, or it's not that prominent, or some full-blown signs that shows how it can affect the neurotypical function of the brain, the child's communication and social skills. Now, I want to use the word neurotypical because a lot of persons carelessly use the term normal. I mean, what is a normal brain? An autistic brain just functions differently. They are bright, they are innovative, they are creative individuals nonetheless. They just do not necessarily fit within what we would consider to be a neurotypical brain. So let's change the language and the conversation when we are having this conversation about ASD. So what would it look like? There's a myriad of different characteristics or clinical signs, but I'm just going to talk today about three important ones: unusual eye contact, difficulty mixing with other children. This is not to say if your kid is shy, your child has ASD, but it's more in an unusual way. You know, after a certain age group, especially like when they're like around 3 to 5, and so kids enjoy and relish being in the company of other children. If you notice your child or your loved one is a lot more withdrawn, or really and truly seems to be a bit more bothered when they're around children, it may be something that you should just have a nice discussion with your healthcare provider about. Marked physical overactivity, and we see that a lot, or extreme passivity, as in they're not really doing much. They're processing, they're there, but they just don't operate or behave similar to other children that you know. There's only one way to know for sure, and you should ensure that your child or your loved one gets tested by the physician, and they will guide you through the process, series of testings, so that the correct diagnosis can be made. Now, I want everyone to take away from today's presentation that there is help. And when I say there is help, early intervention by a therapeutic team is key. If a child who receives early intervention versus an adult receiving intervention has two varying different outcomes, especially if they're the same level of the spectrum, why not give your child or your loved one an improved chance by ensuring that the intervention is done as early as possible. And you know what increases chances of that? When we know what to look for. And that's why educating you on this topic is really important to us today. Hydrotherapy. I know if you looked at some of our other series, you would have heard me talk a lot about aquatic therapy or hydrotherapy a lot. But the hydrotherapy does wonders in improving the child's sensory and communication skills as they are learning functional tasks in the water, such as dressing, reaching and lifting, and communicating and playing with other children as deemed appropriate by the aquatic therapist. There's some new research that virtual reality therapy can also be help in the social and communicative skills of those who are autistic. If you already have a child or you know of someone who is affected by ASD, maybe you can benefit from joining a support group. Oftentimes, it's very easy as healthcare providers for us to focus on the patient, but you, the family members, or the caregivers feel the burden or feel the strain of carrying a non-neurotypical child throughout society. Don't be afraid to look through social media or online ventures or inside your community centers to see what programs for support are available to you and your family. Cerebral palsy. Some of us may have heard about this common condition before. It can occur anywhere between ages 0 to 5 years of age, and there are varying classifications based on the presentation of the child. A very key note in the presentation of children with cerebral palsy is many tend to be, when I say spastic, I mean tight. So sometimes it affects all 4 limbs, sometimes affects just half of the body or just one limb. All this will be dependent on what type of classification the child is diagnosed with. Now, I want you to take a deep look at these pictures, and I think you could already start to have a picture as to the varying systems and structures that are affected once a child is diagnosed with cerebral palsy. But you're probably wondering, what causes it and what increases my chances? Well, brain abnormalities, and this sometimes can occur simply because of birth. Now, sometimes as a child is being delivered, they have hypoxic, or because of difficulty with the delivery, the child did not have enough oxygen, and part of the brain, as a result, would have been starved of much needed oxygen as a result, and this child would be diagnosed with cerebral palsy. A maternal infection, which can sometimes affect that portion of the brain, and sometimes a folic acid deficiency. So you see, it's still important to take your folic acids, pregnant women, especially in the very early stages, because we want to minimize its negative or disastrous impacts, because we don't want to be deficient in folic acid. It's very important for brain and fetal development. Now, cerebral palsy affects many different systems. So 1 in 3 cerebral palsy patients, they will be unable to walk. And that's where physiotherapy will come in, and the occupational therapist will come in to improve their mobility and their activities of daily living in society. 1 in 4 would be unable to talk. But good news is that there are speech therapists that would help with their communication skills, and also recreational therapists. 1 in 10 would have severe vision impairments, and you could understand the impact that that may have on their parents or their caregivers and their families. There's going to be a lot more support needed, which is why I reiterate the need for joining supportive groups, okay? 3 in 4 would experience pain, and that's a pretty high statistic. So your physician would ensure that the necessary supports and medications are administered to the patient so that they'll be able to better manage their condition. Unfortunately, 1 in 4 has epilepsy or seizures, which is basically the brain operates abnormally, and the patient may start to react with what some persons call fits, okay? It's like an involuntary shaking control of their body. And sometimes it's not even that dramatic. Sometimes it can be pretty, it's just a mild twitch. You could even miss it. Okay. And 1 in 2 would have an intellectual impairment. This does not mean that all CP children have great difficulty learning. As a matter of fact, in primary school, I was blessed to be in class with someone who had cerebral palsy. And even though there was some deficiencies, she was able to pass her exams successfully, socialize with us as best as she could, have the necessary supports from the entire school and her parents and her friends. And now she's working and have a very happy, healthy life. Okay. So just know that it doesn't mean that all is lost. There is still hope for a great quality of life once the necessary supports are utilized. So there's help. And there is something called hippotherapy, which is basically the usage of a horse. And under the guided hands of a therapist, the CP patient will be mounted on the horse, and the pelvic rocking motions of the horse really and truly could improve the child's posture. And sometimes as a child postures improve, it improves their feeding ability, their social skills, their communication. Yes, it's all related. And a lot of time there's a very deep connection between the child and the horse that could really improve outcomes. Speech therapy, as we spoke to before, could really allow for optimal outcomes as the child is now better able to communicate. Physical and occupational therapy also does wonders for improving the child's motor skills and allowing them to be independent. Sometimes they may need some power wheelchairs or manual wheelchairs, or sometimes they may need some braces. Either way, there is help, but you have to ensure that you sign up to see your physical therapist or occupational therapist. And there's also intensive Soothe therapy. And just as the picture shows us, you're in there with the therapist, and there's different supports that allows us to have a 3D approach to improving the child's posture, improving their tone, which has to do with how the muscles feel when it's relaxed, whether it's too tight or so. We help to regulate that. And it really helps to translate into improved function, child being able to probably feed a bit better, sit a bit better, and move a bit better. And also, behavioral therapy can also do wonders as we try to integrate our CP children into society. So I hope you learned that all hope is not lost if your family or loved one is affected with a developmental disability. Feel free to check out these reputable sources, autism.org and cerebralpalsyguide.com, for further information. Thank you.